Regulation of respiration. See, this respiration is under both nervous and chemical regulation. Both under nervous, which we call neural, and chemical regulation. When we talk about this neural regulation, it means the respiratory center is composed of group of neurons. Where are these located? In the medulla oblongata and pons viroli. So, respiratory center, it is divided into medulla as well as the pons respiratory centers. Now talking about medulla oblongata respiratory center. Here we have dorsal as well as a ventral group of respiratory centers. What happens? This mainly causes inhalation. This is located in the ventrolateral part of the medulla oblongata and it causes either inhalation or exhalation. So this is their workload which is divided, and depending upon which neurons are stimulated in the group, they show either inhalation or exhalation. This is how the breathing rate is controlled in the medulla. Alright, when we talk about pons viroli, we say it is in the dorsal part and its main function is to limit inhalation. Why limit inhalation? Because when we are involved in activities which needs utmost breathing, then that time it is the pneumotaxic center which is going to function properly and help us in limiting the process of inhalation so that the brain can understand. Alright, then moving to chemical. When we talk about this chemical, we say the largest number or group of chemoreceptors. For chemicals, we call chemoreceptors. These chemoreceptors are located in the carotid body. Where? In carotid body. So, they are the aortic bodies. They are located bilaterally, ऐसे, and bifurcation होती है इसकी proper. Clear? So these are basically the afferent nerve fibers which pass through the entire region and they help in locating the arc of aorta, they help in the dorsal respiration, they help in giving us or stimulating the respiratory center of the brain, increasing the inspiratory and expiratory signals, pass these signals to the muscles, increased CO2 levels can be checked, pH levels when they are lowering, these can be checked. Automatically what they do is they do not give a significant or direct effect when oxygen is low. It is not important for them. They have to send signals whenever there is amount of CO2 which is high. Alright, when the amount of pH that increases or that lowers down. So they work in contrast with CO2. That whenever the amount of CO2, the level of CO2, it increases, it decreases. So they show a significant direct effect on the respiratory center. Other than that, Chemical regulations are basically the chemoreceptors which are in the carotid bodies, and they send their afferent nerves everywhere, and these nerves are only showing a stimulatory effect in controlling respiration when there is a significant decrease or increase in the level of carbon dioxide, right? So oxygen does not have a significant direct effect, mind you, in respiration when we are talking about regulation. Fine. Moving to disorders. When we are talking about disorders, before that we need to know एक टॉपिक होता है माउंटेन सिकनेस, altitude sickness, right? What is that? Condition when there are ill effects of hypoxia, that means shortage of oxygen is detected in tissues at high altitudes. When does it happen? When you are going to this high altitude area for the very first time. What are the symptoms? Symptoms mainly occur in the digestive area. Why? Because it leads to loss of appetite, nausea, vomiting because of the expansion of gases. Where? In gastrointestinal tract. Fine. Loss of appetite, nausea, vomiting because of expansion of gases in this area. Then what happens in result of all this? Breathlessness. Clear? Then obviously the neural system is affected. You will have headache. You may find depression, irritability that occurs. Obviously, lack of sleep, weakness, and fatigue. Fine. And what will happen? Mountain sickness, all these symptoms, these disappear as soon as you start breathing normally. And when this happens is whenever this is your first or second experience going to mountains. Otherwise, this problem becomes normal whenever your RBCs get sufficient amount of oxygen. Now, disorders related to respiration. First of all, asthma. What is asthma? Usually, disorders लिखते हैं पहले हम. Asthma is an allergic reaction to foreign substance, right? This is the bronchial asthma, which is due to allergic reaction. And what happens? Allergens. Allergens meaning which cause allergy. These stimulate histamine from the mast cells. अब ये क्या चीज़ होती है? हमारी बॉडी में mast cells होती हैं. These release histamine and serotonin in response to any allergy or allergens because these got stimulated, and automatically it causes the bronchial smooth muscles to contract. जब मसल्स कॉन्ट्रैक्ट हो जाएंगे तो कॉफ, दैट ब्रीदिंग नॉइज होती है ना, जो wheezing sound that occurs, difficulty in breathing, excess amount of mucus is secreted on the walls that may clog the bronchi and the bronchioles. So symptoms: difficulty in breathing, This difficulty in breathing occurs due to cough, wheezing, that is the sound produced. Then due to excessive amount of mucus which is secreted on the walls of the respiratory tract, and ultimately what happens, it is going to clog the narrow bronchioles. These are fine air like particles. इतना सा mucus भी वहाँ पे आ गया, it is going to clog the passage. Alright, since it is an allergic disease, so what should a person do? Should avoid exposure to allergens. Smoking should be discouraged. And moving to all those places where there is dust, allergen, pollen grains, it should be avoided. Alright, and people get bronchodilator inhalers, drugs for the symptomatic relief. Right? Moving to emphysema. The second one is emphysema. 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 It means inflation. पहले तो वर्ड का मीनिंग ही ढूंढ लें. इन्फ्लेशन और फुल ऑफ एयर. What? Where is this problem? This problem is inflation of bronchioles or alveolar sac of the lungs. Why does it occur? Generally, it occurs as we write symptoms whenever the septa between the septa क्या होता है? The division, the septum between the alveoli. Septa between the alveoli, it gets destroyed, and much of the elastic tissue, that is of the lungs, it got replaced by connective tissue. Septa destroyed, something has to come up as a covering, so the elastic tissue, it is replaced by connective tissue. Alright, and major cause क्या होता है? Cigarette smoking, right? And another toxic inhalations, whatever some people are enrolled into. So these toxic substances, inhalation of the cigarette and various drugs over a period of time, they can cause this kind of problem. So basically the alveolar septa, this collapses and the exchange of gases is reduced. Since the elastic tissue is replaced by connective tissue, it is not giving a much effect, so exhalation becomes more difficult. Then what happens, person has to avoid all these toxic inhalation of all these toxic drugs and cigarette. See, next is occupational respiratory disorder. The name suggests what kind of disorder it could be. These disorders are due to the occupation of the individual. Like, see, if someone is working in a factory where the gas fumes or dust is present, right, that environment where the person works, so he's prone to this kind of infection. Then silicosis and asbestosis. These are the common examples which occurs due to the chronic exposure of silica and asbestos. ये जो mining industry होता है ना, उसमें लोगों को ये problem ज़्यादा होती है, because over there silica deposits and this asbestosis, this occurs. Now, what happens to the lungs here? इसमें ना chronic proliferation हो जाती है, proliferation of fibrous connective tissue. What do we call it? We call it fibrosis also. Where does it occur? In the upper part of the lungs and causes inflammation. ये lungs के अंदर होती है and cause inflammation. and this basically takes 10 to 15 more years. मतलब जितनी देर इंसान उस जगह पे काम करता है तो is exposed to that period of time, ultimately is prone to these kind of infections. See, if we talk about these two particularly, these are not curable. When a person is exposed to such irritants, should adopt preventive measures, like you can minimize the exposure of harmful dust at the workplace. You can use some kind of clothing, protective gears, or you can usually get your checkup done. You can take holiday, little holiday from the interval whenever this mining work is to be done, so as to give a proper body rest. Something can be done, cure has to be done, so that you can stop this problem, because this inflammation of the lung area, if it is in the first or the second stage, can be corrected, otherwise not, especially in case of silicosis and this asbestosis. And patient is provided with symptomatic treatment such as bronchodilators, antibiotic, that is provided. Clear? Next one is bronchitis. Inflammation of bronchi is bronchitis. Simple. Inflammation of bronchi. It occurs due to an infection. Same problem, cigarette smoking, or any pollutants which come in contact when you are exposed to, maybe carbon monoxide, that could be a reason. It is the overgrowth of seromucosal gland, matlab the overgrowth of lining of bronchi. Then what happens? It starts producing more mucus, and that mucus, due to regular coughing with thick greenish yellow sputum, it generally is identified with thick greenish yellow sputum, that indicates the underlying infection. Cure, obviously suitable antibiotics. सिम्टोमेटिक है तो सिम्टोमेटिक रिलीफ मिलेगा. Suitable antibiotics so as to stop the inflammation. Now next one is pneumonia. What is pneumonia? Inflammation of alveoli. You know, there is an organism, bacteria, which is known as Streptococcus pneumoniae. Streptococcus pneumoniae, responsible for this infection. Clear? See, when we say infants, elderly people, or other individuals, they are more susceptible to this infection because their alveoli become acutely inflamed. The space which is there in the alveoli, it gets reduced. Why so? Because here this got packed up because of the dead WBCs and limit the gaseous exchange in the alveoli. So oxygen has a difficulty diffusing through the inflamed alveoli and blood oxygen may be drastically reduced. सोचो thickness बढ़ा रहा है ना? If this is increasing the thickness, automatically how will the oxygen exchange will take place effectively? Fine. So people should prevent themselves from pathogens which are causing the disease. This can be a prevention which can be done, and antibiotics are given to treat this bacterial infection. This is what is observed. Clear? Then the last one which has been introduced is SARS. We are right now dealing with coronavirus, okay? And this SARS that means severe, severe acute respiratory syndrome. It also came from China. The first patient of SARS was reported on Feb 26, 2003. And where? In China. And yes, in India, the first patient was in Goa. Causing agent क्या है इसका? Causing agent is human corona virus. This is not a new virus. This has already infected us earlier also. We call it SCV. You will be surprised to know that that time when it was introduced as a new member of influenza viruses. And why do we call this coronavirus, which is causing this disease, coronavirus disease? What are we calling it? COVID-19. That means a new strain of that coronavirus, right? It is a mutant form. We knew it, that this is a new member of this influenza family, and it is a mutant form of influenza virus. It has 2 to 10 days of incubation period, and mode of transmission is same, through contact, respiratory secretion, and that time we used to say that it spreads through cockroaches also. So we used to keep everything neat and clean. Symptoms same. This is how it spreads. Symptoms same. That means dry cough, headache, high temperature, that is fever, loss of appetite, muscular stiffness, discomfort, right? And how we used to diagnose it? It is by ELISA. ELISA is enzyme linked immunosorbent assay, enzyme linked immunosorbent assay. It is basically a molecular genetic test through which the SARS virus used to get detected. So prevention, obviously patients were kept separated, placed in their own hospital rooms. Healthcare workers, like we are doing for coronavirus, healthcare workers and visitors should wear efficient filter masks, goggles, aprons, head cover, gloves when they are coming in contact with the patients. We have to keep our neighborhood clean. So urination and spitting at the public areas, places should be avoided so that this cannot travel. Some other medicines have been tried, but effective medicine for this was ribavirin with some corticosteroids. I'll write it down. The effective virus. With some corticosteroids that was found effective that time in Hong Kong. So we chose this as the antiviral agent. Clear? This is all about the disorders that are observed in the respiratory tract. Thank you.